Sir, you had a talk on hypertension and its management and resistant hypertension in the CSI. So I would like to ask you, sir, what's the prevalence of hypertension currently in India and this part of the continent?
Now, prevalence of hypertension is quite high in India and this continent, Southeast Asia. In comparison to the Western countries, I think the incidence is even more than the Western countries. And at present, what I can say, the incidence of hypertension is gradually rising day by day, and particularly in elderly people, the incidence is about 40 to 50%, and young people in 30 to 40 years of age, it will be about 20 to 30%. So, and after the age of 80, it is almost 60 to 70% of the population, they are having high blood pressure or what is called hypertension.
So as you mentioned, sir, the incidence and prevalence, these are actually increasing in the country. So even in the younger population also, we are seeing much more hypertensives nowadays.
Yes.
So what are the reasons for that?
I think there are a lot of reasons which can explain this high incidence of high blood pressure in young people, because of the stress factors in their day-to-day job activities, particularly in IT jobs, and then their lack of exercise. That is very important. Lack of exercise, because most of the times they are spending their time in the office by sitting on a chair in a air-conditioned office without any movements of the body parts, and then they are taking fast foods, and they are ignorant about some basic facts in their diet, like they are not taking plenty of green vegetables, salads, they are taking a lot of salty foods, there are a lot of junk foods they are taking, and that causes much more incidence of hypertension. And then very important is their lack of exercise. They are not doing any sort of physical activities. They are going to the office, coming back, taking food and eating and sleeping.
So what are the management options you look for this young population, sir, in your practice?
Our first thing is that we have to correct their lifestyle, abnormal lifestyle. That is very important. Unless we correct their abnormal lifestyle, this blood pressure we cannot control just by taking drugs. Because first of the thing is that if this abnormal lifestyle, they can easily practice the normal lifestyle, because they have to change their food habits, they have to change their lifestyle, they have to do the regular physical exercises, and of course most of the times also this young generation, they takes a lot of smoking and other drugs. So smoking has to be stopped. Regular physical activities or daily walking or swimming or some gaming should be done, and then plenty of vegetables, salads and fruits in their diet, much less salt, much less saturated fat in their diet, and carbohydrates also less, and at the same time they have to reduce the stress in their day-to-day life and activities.
Right, sir. So you also spoke about the BP goals. So how do you define the BP goals for these younger adults in our country?
Now, BP goals, once patient is having high blood pressure, I told you at first they have to correct their lifestyle, and in spite of correcting the lifestyle, if the blood pressure is high, more than 140/90, then we have to control the blood pressure by giving drugs. Now, in young people, most of the times it has been found out that by giving one drug, either ACE inhibitors or ARBs or calcium channel blockers or diuretics, beta blockers comes last as a preference of drug as an antihypertensive. So most of the times in young people, by single drug it can be controlled, but there are some people where 2 or 3 drugs can be used. But in middle-aged people or elderly people, it has been found out that unless you use 2 or 3 combination drugs, the blood pressure cannot be controlled, and the target blood pressure level, I told you, in most of the situations it is 140/90, but if there is a significant kidney damage like proteinuria, it should be 130/80, and elderly people, particularly after the age of 60 years, the blood about 150/90 or below.
Right, sir. You also spoke about the resistant hypertension. So how frequently you see resistant hypertension in your practice, sir?
Now, resistant hypertension incidents are what I will say that it is also quite common. About 20% of the people, they are having resistant hypertension, but most of the times it is because of their abnormal diet, because of their abnormal lifestyle, and they are not taking medicines regularly, or they are taking subtherapeutic doses of medicines. So we have to correct the medicines, we have to correct the doses of medicines, we have to correct the food habits, we have to take them to reduce their salt intake, we have to reduce their tummy size. Then most of the people who are obese, they are having resistant hypertension. So you have to bring down their body weight by this proper lifestyle management.
Right,
so in total, what I can say that lifestyle management, that is much more important than medicines or drugs.
So apart from lifestyle management, what are the class of drugs you look for treating this resistant hypertensive population, sir?
Now at first we have to see that whether they are taking in adequate dose, adequate tolerable dose, whether they are taking. And at least we have to take 3 group of drugs, that means ACE inhibitors, ARB is one group, then calcium channel blockers and diuretics. And regarding diuretics, nowadays we are rather giving option to chlorothiazide rather than hydrochlorothiazide. So if in spite of taking adequate tolerated dose of calcium channel blockers, ACB inhibitors or ARBs and diuretics, then only we are telling that they are having resistant hypertension. And in that situations, what we are using beta blockers or aldosterone antagonist like spironolactone or eplerenone, and in spite of that, if they are not having proper control, we can use alpha methyl dopa, clonidine. Those are the drugs which are not being commonly used as an antihypertensive.
Right, sir. Thank you for your insights, sir. So what would be your concluding remark on your topic, sir?
Now, you see, as because it is a very common problem, so it is a very common, problem to be tackled commonly by common drugs and in a normal, easier way.
Right, sir. Thank you very much. Thank you for joining us, sir.
Thank you. Thank you. Western countries, and at present what I can say, the incidence of hypertension is gradually rising day by day, and particularly in elderly people the incidence is about 40 to 50%, and young people in